Welcome to this special edition of City Inside Out. I'm your host, Brian Callanan. As the coronavirus pandemic continues, a lot of concern in our region about older adults, how we care for them, how we care for our friends and family. The CDC, as it turns out, says people age 60 and above, as well as those with severe underlying medical conditions, are at a higher risk for developing more serious complications from COVID-19. So, what's the best way to protect friends and family, or ourselves if we're in this age category? From concerns about long-term care facilities to scams of the elderly and social isolation, we're going to tackle this issue from many sides, and we are going to do that with the help of two guests who are joining us remotely. Patricia Hunter is the Washington State Long-Term Care Ombuds, and Doug Shadel is the Washington State Director of the AARP. Thanks to both of you for joining us. And Patricia, let me start with you here. Your job at the state level is to monitor and also improve our long-term care system. And as everybody knows, one of the first cases of COVID-19 to show up in this country was right here in Kirkland at the Life Care Center. This nursing home, of course, now has seen dozens of cases, nearly 40 deaths. A number of homes around our area, around our state, have shut down any outside visitation as of now as a precaution. I want to ask, what challenges has that created? What's your advice for families and caregivers who are concerned about the health of seniors who are in our long-term care facilities right now?
Thanks for that question. So one of the biggest challenges right now for everyone, including the Ombudsman program, is we're not able to go inside the buildings and visit. That's quite frustrating, especially those people who are, used to going in and providing care, family members who are going in every day to help their loved ones dress, help their loved ones with their meals. It's very frustrating, and people are very worried about it. So what I definitely advise, and I know AARP does the same thing, and it's actually a requirement by CMS, is that facilities help the residents get connected to their loved ones using virtual visitation, and of course phone calls. Even via mail, letters and cards can be encouraging, because there's quite a bit of isolation.
Got it. And Doug, I know the AARP has a list of questions people can actually ask when they're considering a long-term care facility if you or a loved one is there. I want to talk about those basic questions about health, communication practices that you would want to ask a long-term care facility, especially during this time.
Yeah, I mean, I think this is a time for consumer empowerment when it comes to being worried about going into some of these facilities. And Patricia mentioned one of the things you should ask is about visitation.
Yeah,
it's really tricky right now because you're not actually, as she said, able to go in. One question I think to ask, given the coronavirus thing, is has the facility had any cases that have been diagnosed? To find out, and they need to disclose that. I think that's an important one.
Okay, thanks very much for touching on that. Patricia, let's take it a little bit further here. Two questions here, really. What should families do right now if they are planning to get a loved one into a facility? And is it safe, is it smart to try to get people out of long-term care facilities right now? Can you deal with both sides of that question, please?
Sure. So I'll start with those that need to go into, let's say, a long-term care facility for rehab. As Doug just mentioned, you have the right to know if the facility has a case of COVID. So that's something that the family members and residents can ask about, as well as staff. For those people who have the choice and have the ability, Washington State is really well known for the array of long-term care services that are available in the community, especially under Medicaid. So I would definitely encourage families and long-term care residents that if they have that option, they should definitely consider it and explore it and be informed on whether or not this is a realistic option for them.
Yeah, is it a healthy thing to do to try to bring someone who's an older adult into your home? I know some people have concerns about that too, not wanting to infect them or anything along those lines.
The CDC and public health and the hospitals have really great guidelines. We also have that information on our website on what to do if you decide to bring your loved one home. You're going to practice isolation within the home for 14 days. There's now testing is available. You can do that. and certainly you're going to do masking. So there are definitely clear steps that you can do to protect your loved one as well as yourselves.
Okay. All right. We'll dive a little bit more into that testing issue in just a minute here. But Doug, I want to bring up one big concern: social isolation, a huge problem for older adults long before the coronavirus pandemic. It's really been amplified, though, now with this stay home, stay safe order. Any advice for seniors, families dealing with this social isolation issue? It's very real right now.
It is. It really is. I mean, a lot of people are saying that social isolation is the new smoking, and that was before the COVID-19 crisis.
Yeah.
And we need to stay connected. Social distancing is not the same as not connecting. And people have found innovative ways to connect. I heard the other day that Zoom, which is one of the platforms of choice, has 300 million people on it right now.
Right.
So we've heard people having parties where they get together and they help their loved ones get on a platform like that, and in some cases reporting that they're connecting more than they ever have before.
Yeah.
So there may be an ironic twist to this, that this may be, I know I've reached out to some of my family members I haven't talked to in a long time.
Yeah.
So there may be a silver lining in that regard.
Yeah, hoping so on that regard. I know I've reached out to a lot of people too. Everybody's in the same boat in a lot of ways here. Doug, I want to stay with you here. You've written about it for years. Older people are often more susceptible to scams, and there are a ton of them happening right now during the COVID crisis. You've got scammers going after people, stimulus checks. You got identity theft. I want to let people listen to an example of a robocall that's circulating right now about some testing equipment for the coronavirus you might hear on your phone. So let's listen in.
Greetings, this is a courtesy call from 3MS Safety Program to inform you that due to the coronavirus pandemic, the government have authorized our laboratories to offer you the safety and medical kit, which at this moment are sold out in the market.
So what's going on with these scams? What can people do to protect themselves?
Well, there are literally tens of millions of these types of calls ringing into people's homes with robo-dialers, whether it's, hey, you could get a free test or a free mask, or there's a local testing station down the block. Anytime somebody's coming at you with an offer around coronavirus that you did not initiate, that should be the first red flag.
Yeah.
Just simply do not respond to it, because there are hundreds of thousands of these calls happening. And there are all kinds of questions about the stimulus checks, too. So one piece is masks, and we've got a miracle cure, we've got the vaccination, click on this thing. What we're telling people is don't click on those links. Don't respond to emails that you get with those kinds of claims. And if, for example, you're concerned about the stimulus checks, the IRS at irs.gov actually has on their site a place where you can, and this is a trustworthy site because it's the IRS, that you're initiating contact. You can find out the status of your stimulus check. Don't respond to people who can tell you because they called you.
Right. Yeah, no, it's a common thing. I know Social Security, there's a lot of different ways that scammers are trying to go after older people right now. But I wanted to touch with you, Patricia, on this idea of coronavirus testing. I know there's a lot of scams surrounding about it, but there's a serious issue here. Is that type of testing happening at long-term care facilities right now in our state? It seems like making these resources available for our older friends and family would be a priority. Tell us what's happening, what you're advocating for, please.
Sure. So we're definitely advocating, particularly with long-term care residents and staff, to be tested so that we have a better idea of where the resources need to go. And so that facilities know how to protect those that are living in the facility, maybe doing what we call cohorting, moving residents around in a facility so that those that are positive are together and those that are negative are together. But we're absolutely advocating. It's happening in Seattle and King County. They have, I believe, finished testing all the nursing home residents and nursing home facilities. They're doing the assisted living, and now they're piloting adult family homes, which are smaller homes, and there's about 1,000 homes in King County. So I think public health, in partnering with DSHS and long-term care facilities, are doing a really great job in the Seattle King County area. Outside of the county, we could use some improvement.
Okay. All right. Thank you for breaking that piece down. Doug, I wanted to bring up another rather sad side story that's come out of this crisis. People who are price gouging for items like hand sanitizer, face masks, etc. I know that the AARP has been working with our Attorney General in our state to try to put a stop to this. What's happening? How can seniors and their families protect themselves in these situations?
Well, so many of the scams prey on just a number of emotional issues, our fear, our general sense of anxiety, but also this thing called scarcity. Well, what's scarce? Nobody can get a mask. And I was just sharing with the AG yesterday, I myself am getting these solicitations. I was trying to find masks. So, of course, on Facebook, now there's all these companies I've never heard of offering to sell me a mask. The general advice is to initiate contact yourself on platforms that you trust, whatever those platforms are, and don't respond to offers that you get. And try and resist the temptation to pay, $39 for a 10-ounce bottle of hand sanitizer.
Right.
It's just, that's what they're preying on, is the fear, the anxiety, and the scarcity that is out there. And I know that the Attorney General's office is being very aggressive. Bob Ferguson told us yesterday that they've had over 500 reports already of price gouging from citizens in the state of Washington. So that's what you should do. If you see this, you should report it to the state Attorney General's office.
Right. There is a way that you could do that. The Attorney General's office has a system set up so people can report that type of activity. So thank you very much for bringing that up, Doug. Patricia, just to switch gears a little bit here, there's so much attention on preventing fraud, social distancing, COVID testing, et cetera, other immediate needs, I guess, for our seniors. Does that mean that other concerns, let's say elder abuse, neglect in our state at long-term care facilities, I know that you're very concerned about that. Does the state have the bandwidth to investigate that type of activity right now?
So I actually just spoke to the head of RCS that handles the licensing, and they are definitely making a priority the infection control issues, but on top of that, abuse, neglect, and exploitation. So if family members or residents or even workers have any concerns about abuse or neglect, I encourage them to call the state licensing entity, the 1-800 number, and you can find it on the web.
Yep. And
they will go out and investigate. What they won't investigate are some of the other issues that speak to quality of life that might be lower level. So that is definitely concerning, and that's something that the Ombudsman can help with virtually by phone, and we can do investigations as well.
Okay, thank you for that. I know a lot more is going to surface about that once we start to get out of this COVID crisis here. But Patricia, we need to wrap up. I know it's very difficult to look towards the future in the middle of this pandemic, but what final words do you have to say about older adults, their health and well-being, and how best to weather this crisis?
I think staying connected, what we've talked about already, using phone calls and virtual connection through Zoom. If you can get outside and practice safe self-isolation, get some fresh air, exercise, establish a routine. And I particularly want to speak to all those long-term care residents and their families. I want them to all know that people like, the organizations like AARP and the Ombudsman in the state, and even the facilities are all working really hard to be creative to make sure that, we recognize that, emotional health and mental health and spiritual health is just as important as their physical health and safety.
Absolutely. Doug, some final thoughts about the best ways looking towards the future to keep our seniors safe and healthy during this crisis.
I mean, the first words that come to my mind are this too shall pass. It is very uncertain times, but we live in a state. I am very proud of our state, the state government, from all the way from the governor, Patricia Hunter's operation, the ombudsman. So we have one of the best ombudsman programs in the nation. We are all coming together and came together very early on this to fight this jointly. There's no argument within organizations or the government about what needs to be done. Just keep with the social distancing. That's the hardest thing to do. I'm in my 7th week of staying home, and it drives me crazy, but the greater good is served by it. This too shall pass.
Okay, thank you very much, both of you, for joining me here. One final note, whether you are thinking about a loved one or yourself, always a good time to get your financial future in order, your medical plans in order too. On your screen, you will see some links to the AARP, the state ombuds office, which deals with long-term care, and also the state's coronavirus response page. I'm Brian Callanan, and we will see you next time on City Inside Out as we continue our coverage of the coronavirus pandemic. Thanks for joining us.